Thank you so much for allowing me the opportunity, first of all, to come to your beautiful country of New Zealand. It's been on my bucket list to come here. I actually employ two New Zealanders in my practice, or I have in the past. One has moved on, and wonderful ladies, brilliant personalities. And when I came here, I really feel right at home. We're from a region of Ohio, West Virginia, and Kentucky known as the tri-state region that Appalachian people are a lot like you, kind of laid back and easy to get along with for the most part, and I've been welcomed with such warm hospitality that it's not like I'm on the other side of the world. And I've had a few adjustments to make. One is I'm trying to figure out if you guys talk funny or if I talk funny. So I'm not sure which it is. I think it's me, because we're known as hillbillies where I come from, and it's a little bit of a dialect that we get made fun of back home. But the other thing is I've had to walk around vehicles 2 or 3 times to figure out which side to get in, because you guys you drive from the other side. And then another little stumbling block was I went to the fitness center at the Heritage Hotel in Christchurch the other morning, and it says, enter your body weight. So I type in 200, and not quite realizing that you guys are in kilograms. So the little screen monitor there said 1 at a time, please. And so I've had a few adjustments to make. I didn't realize a 200 kilogram guy was probably a pretty hefty fella. But nonetheless, it's been a great week. It's been a busy week. We gave this talk for the first time ever in Christchurch and got a warm reception there. And then last night in Wellington. And I've been able to visit practices during the day. And wow, there's so many similarities, but yet there's so many differences in your practice models that it's really challenged my way of thinking. So I've learned as much probably that, as you might learn from me. And, that's what makes this a nice thing, is we can, gather from around the world and share ideas. And we're facing some big challenges in our profession in the States. And you might be facing those too in the near future, and we're going to talk a little bit about that. But the inside out comment that I'll refer to, and I hope this picture doesn't offend anybody. I just thought it really drove home the point that, there's a book that I read one time called Acres of Diamonds. And in that book, there was a story about a farmer that was always looking to obtain his fortune somewhere else. He went to foreign lands and tried to discover something or to hope to gain his fortune and whatnot. And he was so eager to find his fortune somewhere else that he sold his farm. And then he moved off, and then the guy that bought his farm was plowing the field one day and uncovered acres of diamonds. And so the point being there is that in our practices, we already have an existing database of clients. And Fritz Wood is a well-known practice manager speaker in the States. And he made a comment one time in a meeting one time that really got my attention. He said, you could double your revenue with your existing client base. And that really had me scratch my head and thinking, how do you do that? But I want to, if I just leave you with one comment or a phrase, you've been to continuing education, you get all these ideas and you go home and you never implement them. You try to, or you might get one thing done. But, I love education, and I just hope that this hour gives you something that you can take back to your practice to make a difference. And that's really what my goal is here this evening. So the challenge is, I want to ask you guys this, and the fact that you're here tonight, really, I know the answer, but let's just go through this. Have you really reached your practice potential? Are you practicing the very best medicine? If you think you are, then you probably really aren't. But are you overflowing with abundance of income? And have you reached all of your goals and living a fulfilled life? Well, if we were all of those things, we really wouldn't have a need for existing. I was brought up to think that when you're through improving, you're through. And so the fact that you're here to learn and to promote your profession and to do better tells me that, no, you really haven't reached your practice potential. And we all know that there's acres of diamonds, ahead of us if we just have a positive attitude and look at it that way. But on the gloom and doom side, and I'm not a gloom and doom kind of guy, but I found this nice ugly picture with this dirty road going back through there to just bring home the point that the veterinary industry is really under attack, especially in the United States, I feel. I at least know about it there. But the world economy has taken an impact. Some of the equine practices have shut down in Lexington. Small animal practices have closed. There's just a lot of factors that we're looking at. Low cost spay and neuter clinics and vaccine clinics have changed how we have to practice. There's actually a bill in the U.S. Congress right now and it's sponsored by Walmart and the big box stores in our country, forcing veterinarians to have to write prescriptions or write scripts for their medications, so that the pet owner has choices to go and try to purchase those elsewhere cheaper. And Walmart will sometimes offer $4 prescriptions or even free prescriptions. And we just can't compete with free. But they'll use that as a loss leader to get you in the store, so you fill up your buggy with bread and milk and all the other consumables that they do. So we're battling that, and we're slowly losing our pharmacy revenue. And other indications, the online pharmacies, PetMed Express is huge. We get requests in our practice every day for Rimadyl, and of course you don't have heartworms, and I don't know how you manage to practice without having some heartworms in your country. We've lived on the heartworm preventative. We've ridden that pony for a long time, but as a matter of fact, I hate to even say this, but there was the discussion this week about me importing some dogs that were heartworm positive and a few cans of mosquitoes to help propagate that disease so you guys could have a little boost in your economy, but that was pretty morbid. But anyway, heartworm disease is an issue, but the pharmacy component, we're losing that to competitors. Our veterinary schools have increased enrollment by 20%, every one of them. And I just celebrated my 20-year vet school reunion at Ohio State. And they serve on a board there of advancement for the college, and they have increased from 130 students graduating per year to 162. So there's going to be a whole lot more of us in the marketplace looking for jobs. Kind of devaluing perhaps the salaries and all that veterinarians make. And then Bayer did a huge study with Brack Consulting and North American something to study economic issues, NCVEI. And they found that even pre-recession, that veterinary visits are taking a slow decline. People are coming into our practices less and less. And I don't know if that trend is also true here in New Zealand, but in the United States, we've seen a decline. And I've been thinking about why that's happening. And this is my opinion. There's no data to prove this, but practice managers has been telling us for a long time to raise your prices. You need to raise your prices. And I think we did. The problem is we failed to communicate the value of our service as we did that. And we used the wrong models to get people into our practices, like vaccine and reminders and things like that. So anyway, with veterinary visits down and all these other factors, we're facing some real challenges. So we know, obviously, that change is ahead. The world is in a constant state of change, but my concern is the rate of change is changing. And we're going to have to really be proactive and not just sit back and take it. And so what's our response? My thoughts are, we were all taught about the survival of the fittest, and I used to always think that the survival of the fittest meant that the strongest and those with the most endurance were the ones that survived. But when in reality, the ones that survive will probably most likely be the ones who best adapt to change. And so that's just how we want to kind of view this. So do we want to sit back and be the victim and be reactive to the forces that are coming against us? Or do we want to be more proactive and become the victor? So our choice really is ours. I think that we have the option to stay green and grow, or ripen and rot, so to speak. That's just a phrase we use at home, and maybe it's commonly said here. But I really feel like the future is up to us. We have some choice. We don't have to sit back and be the victims of what's coming at us. We have something to say about it. But here's a little bit about that study, and I don't want to spend too much time on the details. And these kind of things tell me that there's opportunity. And pet owners said that they would come to the veterinarian more often if I knew I could prevent problems and expensive treatment later. So 56% of cat owners and 59% of dog owners thought that if they really thought they could prevent some disease, they would come more often. Or if they were convinced that my pet would live longer, roughly 55 to 60% said they would come more often. And here's another, we got to address the expense issue because half of them felt like, if it wasn't so expensive, I would come more often. So these things are telling me that we failed to communicate these things to our clients. We failed to explain why we charged them what we charged them. We failed to teach them that, yes, we can prevent disease and help their pets live longer. And we didn't put the value on the examination. And I can tell you that probably 10 years ago, some practice manager in one of my CE events said something to me that really hit home. He said, how many of you guys give free exams and then charge for the vaccines? I had to raise my hand. He said, why in the world would you want to give away the most valuable part of your training and your education and then charge for something that anybody can do? And that really hit home with me. And we've done that. So about that time, 5 or 10 years ago, whenever it was, I went ahead and just made the transition just because it bothered me about what he said. So now I charge $45 or $49 for the examination, and then the vaccines are minimal because anybody can do that. The low-cost place down the street's giving the shots, right? So it might not have made a difference in my revenue, but it from a mental state, it at least taught me that my exam is valuable, my time is valuable, and I think that's what we have to stress. So there is room for improvement, and we know that there was a study that AAHA, the American Animal Hospital Association, did in 2001. It's a compliance study, and they showed that if you didn't have a vaccine or a shot tagged on that reminder that went to the pet owner, that 35 or 40% of people wouldn't even bring them in. You can't remind for an exam and get a good return. And so that's more evidence that we failed our clients by telling them that the vaccines were the important part of the visit, that the shots were important. Not that you're giving them a wellness exam and doing a dental exam and uncovering potential cancer or tumors and whatnot and doing testing. So here this other study kind of proved it as well. Pet owners said that they wouldn't take their pet to the vet if the vaccination wasn't needed. So 41% of cat owners and 33% of dog owners. And that they would only take their pet to the vet if their animal was sick. Nearly 40% of cat owners don't even take them to the vet unless they've got some type of an issue. And of course the whole feline visit thing is way down, and there's big studies going on now about how to make your practice more cat friendly and how to reduce the stress on cats coming into the practices and what we can do to change that. So that's kind of a part of this Bayer study. A couple other things, people want competitive product prices. We're losing product sales. I mean, we're hanging on to everything that we can, but we have to price them competitively to stay in that market. And here's some interesting things. Somebody asked them a question about wellness programs billed monthly. Looks like they like that. And they like this packaged health program put together on an annual basis. And I think there's something there that should give us a clue on the future of how we do wellness, perhaps. And they liked extended business hours, and that's something that I'm kind of toying with in my practice. And I've seen some different models happening here with extended hours and so forth. So that's all good. So the message that we need to communicate is, if almost 60% would come more often if it would prevent illness, then we really need to talk to them about wellness testing. And here's the thing. I can remember when we first started doing blood testing like that, like pre-anesthetic testing and maybe some senior wellness, and we kind of started this years ago. But when I would get a normal result, I would have this guilt that I was ripping the client off because I didn't find anything. Here I spent your money and shucks, I didn't find anything. And so I had trouble justifying it, especially coming from a large animal background where, I'm already feeling bad about having to charge them, where you've got a cow that's worth this much money and your bill is $200 more than that, right? So that's the mindset that I came from. But normal results provide value to the pet owner. That's something they're looking for. They're looking for health and wellness. You and I were trained to look for disease. So we're disappointed when we don't find disease. We got to think different. We need to look for wellness, and that needs to be our focus. And that's why the examination is important, and doing this testing is really critical. And we know that we can find subclinical disease that you can't tell by looking at the pet if it's in early stages of renal failure or liver disease or whatever other things are going on.